Marcel Otto, and I'm a NDS channel consultant at Kyocera Document Solutions. We specialize especially within the ECM space of digital transformation. So enterprise content management in digitizing your documents and your processes from paper format into more paperless processes. Wonderful.
I'm Ryan Hitchcock. I'm from Kyocera Document Solutions consultant as well. So Marcel and I work very closely together with a lot of our channel partners in turning all documentation digital and making processes a lot more digital.
Mm-hmm. And you, sir?
I'm Dr. Makaka from the Department of Health in KZN. I'm responsible for healthcare systems and also IT infrastructure.
Wonderful. Right, so I think the first big question, just to going hard, is what is the biggest challenge that we're facing with transformation? Let's try and keep it specific to the South African market, because there are some challenges which transcend every country, really. But what are some of the big challenges that we're facing here in South Africa that we should be tackling?
On our part, it's definitely the adoption phase. There's people that have a negative effect to going digital, just purely out of the fact that it's either the environment in terms of our South African market. Not everybody's computer literate. People get quite scared in terms of what we're going to make them do, or they also get left out of the process. So the people that are actually using the product on a day-to-day basis aren't involved in the solution, like the building of the solution. So in the adoption of that, they're just not so happy to do it. So I think we need to just sort of involve the people that are going to use it more and get those solutions right from the beginning.
Yes.
And always take into account that people aren't necessarily computer literate and make those forms or processes as user-friendly as possible for them.
I'm glad you didn't say train them more.
No.
I think from my perspective, I think what we find on a daily basis, because look, we're not specific to the healthcare industry, but a lot of processes are generic, and you find similar processes throughout any business. You've got patient files, employee files, you've got accounts departments. So, but at the end of the day, I think the main challenge is educating what is available and what is out there and what is actually possible and what is legal today. I think legislation is maybe a bit behind of what's available in technology, so people are wary of what they actually can adapt to and what they're able to use. So we've got records managers that we work with very closely, especially with POPI Act and compliance and these things coming out. So we are able to advise them and get them to be a lot more comfortable with adapting and implementing more paperless processes. So I would say that's definitely one of the challenges. And then again, with not being educated, there's with the ECM, electronic content management, digital transformation phases and steps that we go through. I think a lot of people, it's like a problem that's there, but they don't feel, because business carries on. And although the visions that they have for their business is sort of new age strategies and visions that they have, but the operations within that business, when you dig deeper, you realize it's actually still very manual and very 20 years ago. So people have started using computers, and they do use cell phones for email and that, but the technology has actually grown so much since this technology has been available. So, look, I think that's the other thing. People might think we're quite far behind. And so where do we start? And I think that's probably the best way is to just get started. First, you need to understand, you can have all the technology in the world, but you need to understand what's going on in your own business.
Yes.
If you don't understand your own processes, if they're not working as they are, just digitizing that into an electronic process is not going to fix your problems.
That's right.
So, yes, look, I would say, again, most companies we deal with, you would think that there are some of them that have definitely adapted, which I feel is quite advanced, but 90% of the clients we deal with, when you get there, and these are really high-end clients where you would expect that they would be up to date with what's going on in this space. But you find that they're still doing things in the old manual way. And so first of all, just try and understand where you are with your current processes. So we've got the steps that we go through, and if the first step is just to digitize your current paper documents and records, and getting that into an electronic format that is easily searchable and retrievable with instant access wherever you are, we are able to tap into that and get that sorted for you. But then we're starting to use and understand that information, you're able to then transform and digitize and optimize your business processes going forward. I'll give someone else a job.
It's quite interesting what you're saying there about digitizing a form or a process which already is really very good. So, very early on in my career, I actually had to digitize a form which we used for all patients in the hospital to know what their blood sugar reading was. But the truth was that that paper form was already confusing the doctors and the nurses using it, and there were errors. And digitizing the form made the process even worse. So it's really important to have that good understanding of what's actually going on the ground, actually what's happening with the current process before you then look to digitize it. Would you like to elaborate, sir, on what you've seen specifically, challenges with transformation in healthcare in South Africa?
Yeah, firstly, the first challenge is the infrastructure. Although the government of South Africa have got a broadband strategy, but we're still battling with the infrastructure. And a lot of that we can not implement any system on a minimal requirement of the system with the current situation of our infrastructure. That's the first challenge. Secondly, the Department of Health nationally has developed a framework. And that framework, there are few systems that qualify, that actually comply with the framework. But again, the various departments cannot implement any of the systems because they don't have the detailed information. Then thirdly, as my colleague mentioned, the issue of users. Whenever you implement any system, users play a key role. From the development stage, from the design development stage to the implementation stage. If you miss that point, then you have a reluctance from the users. And in order to address that particular issue, we need to deal with anxiety. Change the users from being anxious to be confident about the system that's being implemented.
Thank you.
Maybe lastly, there's the issue of budget. Because we know the challenges at hospitals, and we know we do have a solution for those challenges, but there's not enough budget to implement it.
That's definitely a problem. It's the same problem we face even in the UK for me, is that there's not actually enough money to get everything done, or rather maybe there is sometimes enough money, but it's poorly spent. Can we get a roaming mic? Because I'm definitely going to pick up in the audience. We've got one, wonderful. Because one of the things I wanted to elaborate on that point is the fact that this anxiety, this stress that a lot of people have. Have I just been deactivated again? Hello? Can I be heard? Oh, there we go. So one of the big issues that we face, I keep going, don't I? Is it my microphone, do you think? Are you worried about the wires I've got? Let's keep going. Is this anxiety that you mentioned is the fact that because they don't fully understand what's coming, they're going to be scared. Who here is afraid of spiders? I don't really like spiders. But when I appreciated that I'm bigger than a spider can't really do anything, even the venomous ones, it allowed my anxiety to go down a lot. And sometimes it's as simple as that, is breaking down what actually am I going to be facing on the wards with this new technology. Is it going to make my life harder or easier? Is it going to save me time? Is it going to allow me to provide better care for my patients? Will it give me more time to speak to my patients? And when you just tell someone yes to all those questions, actually, they're excited about this new solution. So I find some of that engagement piece, we're just getting people to know what you're doing, what's your intentions, what's going to be the output. People then become excited and they become your champions to adopt this new solution. So as I was saying, I'm going to pick on a few people. So those that had their hands up as clinicians are really keen to hear about your experiences with a transformation. It could have been very, very small, could have been huge, but actually what's then happened when you've had a new process being implemented? What made it harder? What made it easier for you? Don't be shy now. I can see you watching me, so that means you want to answer that question. Is that right, miss? Can we get the mic? Just at the front here. Yes. Yes, you, miss. Didn't you say you're from a nursing background? Why are you shy now? Who else would you like to answer this then? There we go. It was a risk putting someone on the spot. It's paid off finally.
Thank you. We are in a process of digitizing a healthcare facility that is more in the occupational medicine space. One of our biggest challenges is the records are very old, 50 years old, and the issue of ink and all that is an issue in terms of trying to move from that to a digitized platform. But also the big challenge is storing X-rays and ECGs with the sort of paper that had been done on. The next challenge that we are now facing is with courts. Some of our cases do end up in court, through the litigation process, and what we've now moved from a written format to a digital format has not been signed. So how do we manage that? Because that's really where our battle is sitting, that we've just scanned everything on digital platform, but some of the things are not properly signed by the treating physician or whoever saw the patient 50 years ago.
And what have you identified a way of being able to deal with those problems? Because especially if it's a 50-year-old record, that person who saw that patient, they may not even be alive anymore.
No, that's true. That's very true. It's part of some of the issues that we're going through. But I think I just want to understand, how do we come around the issue of signing on the digital platform when you scan records and transforming everything from paper to digital?
One of the things, I'll ask the panel actually, what have been your experiences with digital signing off documentation? What are the best ways to do that now?
Look, in South Africa, if you use digital signatures for legal documents, you have to go through the law trust to have it certified. So there's a certificate that needs to be issued for the signatures that you're using on those documents. And so that will stand up in court if if you follow law trust with using digital signatures on electronic e-forms, transformed documents and legal documents. So it's got all sorts of information built into it, a date stamp and authenticity and all sorts of other geotag locations and things that it includes on the document itself, and with certain checks and terms and conditions that needs to be checked by the person signing the document as well.
I think just also another thing is that we need to put rules in place for documentation. And as soon as you digitize stuff, you can start putting rules in place. That if a document isn't signed, that it's not going to go through the process, the next following process. Otherwise, you're going to have information like this happening in 20 years' time again, where you can't go back and find any documentation. I think it's very difficult to fix what happened 50 years ago, that you can stop it from happening going forward. So,
just on the 50-year-old documents, I don't know what the quality of the documents are like, but with the software processing tools available, you actually it's possible to do image enhancement on those documents. So once you scan the documents with the processing on the processing engine that runs on the server, it's able to do de-skewing and de-speckling and enhancing the quality of the documents as well. With OCR technology, we're able to extract the text of those documents. If it were documents that were typed, we'd be able to extract the text, and you'd be able to even search on keywords and metadata on those documents if you need to retrieve information. Especially if you've got 50 years worth of documents, finding one single document within all your records could be very time consuming. So Once it's into a system like an enterprise content management system with the advanced search engine, you're able to do Boolean and fuzzy and all these other search terms to find the documents and limit and to what you're looking for. And you can then start using your data. If you've got for example, if it's a litigation process and you're following, I don't know how all the documentation might be, but if you're looking for a similar case and how it's been handled back then and you want to find related information, once your information is searchable within the system, you are actually able to start find trends and start doing more analytical reporting and searches on your information that you have, and actually get your information to start working for you instead of just lying downstairs or in a filing cabinet not doing anything for you.
On the issue of the electronic signature, one way of dealing with that, if you find the process is too long, you can just print out the document, sign it, and scan it into the system again. Then the issue of keeping the records for 50 years, then I'm not sure whether the archive policy does allow us to do that, because you need just to go through that policy, because it says you can keep the documents for a minimum of 5 years. But you need just to check on that as well.
Yeah, that's one thing that I've seen as well in the NHS. In fact, when I was doing work experience as a teenager, I was in the filing department, and they had so many pieces of paper for patients. And there's times when it's for a child patient, they're a year old, and there's literally thousands of sheets of paper, and you have to keep it for a minimum number of time. But the truth is, all I want to know as a clinician seeing them at that moment of time is, what is the broad strokes? What's the main things that they have gone through? What medication are they on? What surgeries have they had? What's their family history? And what's their health now? All those other sheets of paper, I'll literally never read it. Never.
So what we found with a lot of our clients that we deal with, when you go through the cabinets and you go through a file that might have 100 pieces of paper and documents within that file, and you filter through it, and you might find that only about 5% or 5 of those 100 documents might actually be originals with a signature on that classifies that as an original document. The rest of them, if you scan it and you print it out, it's going to look exactly the same as the other document you have in the file. So just with space and archiving, if you have to keep records for 21 years or 5 years or 7 years for accounting records, whatever it might be, you might be able to eliminate it by probably 95% already by just keeping the vital records. It's really an original record in your file, in your filing cabinets.
Yeah. Can we get a quick time check? How much longer for this segment? Another 5 minutes. All right. Very quickly then, for the last question, because that should round us up for 5 minutes, is if we're going to get new solutions coming into a hospital or community health practice, what are the sort of like top 3 considerations that one needs to make? Because the most obvious one is that it actually does what it needs to do as a product. But are there any other things that we should be thinking about? So what would your thoughts be on that?
Well, I think everybody knows the end result that they want to get to, but not always what it's going to take to get to where they need to go. So sometimes the end result could be 5 or 10 years away, depending on, you need to fix stuff going through the process. So I think people need to have a bit of a sit down and have a look at their business structures and where they're at the moment and where they want to be. If it's we talk AI and all the wonderful things, but if you don't have any data at the beginning, there's a lot of steps that we still need to follow to get to there. So a little bit of business sort of understanding, being a big part of it. I think that's obviously one of the most important things for us on our side.
I would say once you're aware of what you have and within your business process, understanding your own business, to go back to what I mentioned earlier, then with some awareness of what is possible, you should then be able to sort of get an idea of, okay, this is everything I need to address. So in my different departments, whether it's within HR for HR onboarding, and whether it's patient records and admissions, what kind of solutions are there available on the market? Is there like a one-size-fits-all? Is there something that could take care of all of these pain points and that we've discovered? And then, really, I think in that sense, there are solutions out there that's able to take you on a journey, and without having a whole lot of different systems plugging in and not really integrating with each other, finding a solution that could probably in time start with your priorities at the top and work your way through. Because if we just look at just business process management itself, if I have to think of in healthcare situations, it doesn't have to be with business process management. You can actually start designing processes that can take you out of the office. But if I would think of an ambulance, for example, that responds to an accident on the highway, and when the medics get there, they should be able to have a tablet and take the vitals, if they're not already. I'm sure a lot of them are doing that already, but be able to take all the information right there on the spot and be able to submit this, and by the time you get to the ER room at the hospital, everything should be there. So, the response times and everything else, it depends on your requirements. And also, I think just worth mentioning, I think a lot of the discussions today have been around hospitals and that, but I think healthcare is far wider. I mean, you've got your dentists, you've got, so, it's not a one size fits all. So is there something that's going to suit me and my practice or whatever I specialize in? Is it customizable to what I need, or is it something that I have to adapt to? So I think that's a very important thing to consider. There are brilliant products out there that it's like a one size fits all, and you use it, but to change that is not always quick and easy. So the way we do business today and the way we do it next year, this time, might be completely different. So, how quick is it to change? How flexible is it? What's the relationship I have with the partner I'm partnering with? What's their support structures like, especially if it's a life-threatening situation and the technology is not working, or you need information? This is a very sensitive and vital industry to work with. So you've got to look at all those type of things. I think all around, you've got to build a partnership with who you're partnering, and then look at how do they have all the tools that you need for all the requirements you have, and really get to understand what they offer, and if it will take care of all your requirements.
I think a buy-in from management is also important when you implement any healthcare information system. Because currently they would say that the system is critical, they need it to address the challenges, but they don't put money into that, as I said earlier on. But again, if they don't have a buy-in, then there will be no solution for any challenge. Just to make an example, IT budget always compete with other services in healthcare sector, especially the pharmaceutical services. The appointment of doctors and nurses is even worse when there is an outbreak. Because that money, even if it's allocated for IT, if there's an outbreak, it's shifted to address that problem. Then lastly, I would say that we definitely need to address the issue of the infrastructure. That is critical, otherwise you can't start working without a crawling first.
You have to have a strong foundation to build on.
Yes. That's very important. And the issue of the broadband implementation program is very slow. It's very slow at the moment.
Nothing good comes easy, they say. So just to summarize, definitely any business analysts in the room, UX practitioners, the whole act of conducting a work processing exercises, looking at the whole process that people are going through, map that whole thing out so you know what's actually going on, and seeing other ways to optimize it, and see how technology satisfies those needs. Really understand your different stakeholders and ensure that whoever's going to be your supplier actually can deliver. There's no point getting a supplier who's only going to do half the job and then the other half is telling you to change your work process. Can't work like that. It's a very, very good way of alienating your staff and people who need to use your technology. and as you elaborated on, infrastructure is crucial. Actually have the technology that you need in place. There's no point going to a surgeon if they don't have a scalpel. So I want to thank the panel. Thank you as well for being a great audience. And yeah, next session then.
Thank you very much. Thank you very much.